Coming up on Medwatch today, a hospital open house turned into real-life experience for an employee and his son. How a tough diagnosis became a little easier following a program that aimed to improve routines for medical staff. Everyday advice to maintain proper eye care. We'll go back to basics and also discuss one thing you may not know when it comes to wearing sunglasses in the winter. Plus, quick access to care when you need it most. The Prompt Care Clinic that can get you out of the long emergency wait time and in to see a doctor fast. Hi there, and thanks for joining us. I'm Julie Musgrave. Many community employees come up with ways to keep learning to make sure the care you receive is both efficient and thorough. For one nurse, his son's involvement in an open house went from just practice to real life experience.
It's kind of coincidental in a way because I was practicing to be or pretending to be in a hospital, and then I'm actually living it.
3 years ago, Thomas Riley went to work with his dad.
And it was parents that work in that facility. Some of their kids came to kind of help out and volunteer.
Kevin's an RN in the post-anesthesia care unit at Clovis Community. They call it an open house, a sort of practice run for employees to go through different situations and help improve processes for surgical services.
Said, hey, does Thomas want to come and be a patient? And you guys can work, you'll be in the recovery room and he'll be a patient going through the operating room and into recovery.
Thomas says he loved it. It was all pretend. And then,
about 6 months later, he was having some symptoms that we thought was maybe like flu.
Thomas needed surgery, for real this time. He had a brain tumor.
As a parent, you're just kind of in shock, disbelief. You kind of are, even as a nurse, it almost felt like that didn't really help.
So what do we do now?
The Rileys say as difficult as it was,
It's ironic and coincidental at the same time.
They drew on that open house experience to get through it.
It was similar. I was hooked up to similar machines, similar everything.
Thomas underwent 7 weeks of daily radiation. It wasn't easy, but his dad says doing the practice run helped make it easier. It also gave him a whole new perspective on work.
I know sometimes when patients, especially when they're in the recovery room, families are waiting in the waiting room and we're working, so our day is going along like any other day. When they're in the waiting room, I think people feel like the clock's spinning backwards. It doesn't become commonplace, but it's your job and you see it every day, and it kind of becomes like, okay, this is what we're doing, and it kind of puts you in that position of, wow, okay, this is what some of these families are going through the whole way through, not just the small amount of time that I see them.
Thomas now goes back once a year for a checkup to make sure the tumor doesn't come back. Thomas says he'd much rather be the practice patient than the real one. Today, he's doing just that.
Awesome. I'm doing awesome.
So glad to see he's doing so well. In other news, proper eye care is just as important of a routine as, say, brushing your teeth or making your annual physical exam. We sat down with an optometrist to go over some of the basics of what it means to properly take care of your eyes. Today we are talking about eye health and eye care. Let's start with just the basics. How often should someone come see an optometrist?
It really depends on the individual, but you should go in to see your optometrist, and then after they've determined, if you have diabetes or if you're a contact lens wearer or you have certain specific issues, they will tell you maybe it's yearly. If you're maybe 25 and everything's healthy, maybe every couple of years. It just really depends on the individual.
And you guys are also keeping track of kids too.
Yes, children, most people don't realize, but children should probably have their first eye exam about 2.5. Now, if there's a family history of lazy eye or something of that nature, the children should probably actually have their first eye exam around 9 months.
What are some things that you're looking at when you're doing a checkup?
Well, we're checking everything. We're checking the front of the eye, the cornea. We're also looking at the lens. Is there a cataract there or something of that nature? We look at the retina. We want to make sure it's healthy, and the nerve. You know, looking for glaucoma. Again, if you're diabetic, maybe there's bleeding. There's a multitude of things that we're looking for.
What are some things that people can do every day to manage their eye care?
One thing that's very simple and is very helpful is protecting your eyes from the sun. So wearing sunglasses will slow down cataract development. Everybody gets cataracts. That's one thing that people don't realize. Another thing is sunlight can damage your retina. So having that sunglass on there will help minimize those risks.
Okay. Good advice. Thank you so much. We appreciate your time.
Thank you.
Dr. Beaudenay also says wearing sunglasses in the winter can really pay off on down the road. Coming up on Medwatch today, doctors are on high alert when it comes to the flu. Why this season is one of the worst we've seen in years, and California is one of the states being hit the hardest. Plus, it's the end of an era for one of Community Regional's respiratory therapists. He's retiring, but he's not disappearing from all of his duties just yet. We'll explain how our healthcare hero is keeping one very special tradition going even after stepping away from work.